My name is Kristen and thank you for attending this continuing education session. Today, we will be discussing health literacy. Our objectives: at the end of the session, the learner will describe how low health literacy can negatively affect a patient's care, list possible red flags indicating that a patient may have low health literacy, as well as describe ways to improve communication with our patients. And the definition of health literacy is the ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions and follow instructions for treatment. Health literacy includes skills necessary for a person to participate in the healthcare system. Skills can include things such as reading and writing, calculating numbers, communicating with healthcare professionals, as well as using health technology. There are different factors that contribute to a person's low health literacy. First and foremost is someone's general literacy, how well they're able to read, write, understand written text and numbers. Oftentimes, the information that we hand to patients, discharge instructions, education materials, are in written text form. And if a patient can't read or can't read well, then they're not going to understand the information that we're providing to them. Other factors include the complexity of the information being presented. As healthcare professionals, we also often use very complex medical terms that a patient may not understand. Or maybe a patient was newly diagnosed with something they've never heard before. That can be a lot of information at once. They may need to learn how to use new technology such as a glucometer, or learn how to give themselves an injection, or learn different terms that they've never heard of before, which can be very complex and difficult for someone to understand. And other factors include cultural influences, which can include language barriers. If we're speaking to a patient whose primary language is not English, and they don't understand the actual language, then they're not going to understand the health information that we're providing to them. Health literacy can affect a patient's ability to navigate the healthcare system. This includes making appointments, finding providers and services, following through with those appointments, as well as filling out forms. First thing patient has to do when they go into the hospital or when they go into a doctor's office is fill out a form. And if they don't understand written text, if it's difficult for them to see the text, or if it's not in their language, then this is going to be something very difficult for a patient, and it may scare them away from medical appointments or make it harder for them to navigate the healthcare system. Health literacy also affects a person's ability to share personal and health information with providers, as well as ask appropriate questions, maybe because they don't know what to ask, or they're afraid to ask questions because they do not want to appear unintelligent. So it can be difficult for them to participate in care and engage in self-care and chronic disease management, again, because they don't understand the information that we're giving them, so they're not going to follow through with their treatment and management plans. Now let's take a minute to put ourselves in the shoes of a patient that may experience low health literacy. On your own, go through this paragraph and try to decipher the words in them. And in the interest of time, I'm going to go through this paragraph with you. So, to try and read this, your physician has recommended that you have a colonoscopy. Colonoscopy is a test for colon cancer. It involves inserting a flexible viewing scope into your rectum. You must drink a special liquid the night before the examination to clean out your colon. In going through that example, did you find that you were more focused on decoding the words as opposed to what the paragraph was actually saying? Now, imagine yourself as a low health literacy patient being handed a form to fill out, or being provided information sheets to read, or discharge instructions. This can be very overwhelming for a patient when they can barely read, so they're focused on trying to decipher the words instead of really understanding the meaning of the message behind it. Or picture yourself being handed a form that's not in your language and you're being asked to fill it out. How does it feel to try and fill out a form that's not in your language? It can be very intimidating for patients and very scary for patients to have to try and fill out information and provide answers to questions that they aren't really sure what's being asked of them. Or many older adults have difficulty reading fine print, so it can appear blurry, which makes it harder for them to read and more intimidating for them to fill out. Now, I do have a short video clip that I'm only going to show a part of in the interest of time, but this video shows some examples of low health literacy patients.
I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say one tablet twice daily, I don't know if they're talking take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning. And this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office and most people, if you realize, first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
Okay, that's just a short snippet, but it does have many good examples of how low health literacy can affect patients. And what does this mean for patients? It could mean that an asthmatic is less likely to know how to use their inhaler, or a mother less likely to know how to use and read a thermometer when their child is ill. Low health literacy results in higher rates of medication errors, lower rates of treatment compliance, again because patients don't understand what they're actually supposed to be doing. Reduced use of preventative services, which can mean an increase in emergency room visits. Ineffective management of chronic conditions, longer hospital stays, and an increased rate of hospital readmissions, as well as higher mortality rates. Now, we know health literacy is a problem, we know it's very serious, and now we're going to go through what we can do to help enhance health literacy and improve communication with our patients. And first, we must identify these patients. They can be difficult to identify. You can't always tell by looking. A person may seem well educated, they may speak well, yet fail to understand treatment options or medication instructions. And we must recognize the red flags, which would first be a patient registration form being incomplete or inaccurately completed, not following through with medical directions or procedures, lack of follow-through with laboratory tests, imaging tests, referrals or consultants, lack of follow-through with medical appointments, as well as difficulty in articulating or explaining their medical concerns. When a patient is handed written information, another red flag could be if they say, "I forgot my glasses. I'll read this when I get home," or "let me bring this home so I can discuss it with my children." And again, many patients who fail to understand health information may avoid asking questions out of fear of appearing stupid or annoying. So to improve communication with these patients, we must take the correct steps, which is speak slowly, teach back, encourage questions, plain language, and show examples. We need to speak slowly so that they have time to understand, and we need to take time to understand the patient's concerns and limit the amount of information that we provide at each encounter. When we're teaching, information is best remembered when given in small pieces and when repeated. Teach back is a great method to help to understand if a patient really understood what we told them. Confirm patient understanding by ask them to repeat the instructions back to you. Teach back involves us teaching, demonstrating the steps they need to take, explaining the steps that they need to take, and then asking them to repeat it back to us. So, as an example, if I were to teach a patient how to apply lotion to their hands, this is a demonstration of what I would say to a patient. First, you're going to take your lotion, open the cap, apply a dime-sized amount of lotion in your hands, then spread the lotion evenly all over your hands. Rub it in as best you can, and then you're done. Now, can you please show me how you would apply lotion to your hands at home? And then they'll give a return demonstration and explanation back to you, and you can evaluate whether or not they really got the information. This is great when teaching new things such as how to use a glucometer, how to give yourself a subcutaneous injection, or anything else that you need the patient to be able to do on their own. We want to encourage questions, make the patient feel comfortable and at ease. If we sit down with the patient and talk to them face to face instead of standing over them, that can be less intimidating. We don't want to use closed-ended questions such as, do you have any questions? Does that make sense? Oftentimes, patients are going to be agreeable and say, no, I don't have any questions. Yes, that makes sense, because it's easier, and again, they don't want to appear unintelligent. If we open up the lines of communication and use open-ended questions such as, what questions do you have? That could encourage questions a little bit better. Using plain language is very important. Non-medical terminology, words that we would use in everyday conversations that are easy to understand. Instead of saying we need to check your glucose, we would say blood sugar. When giving a medication, we wouldn't say take this orally, we would say take this by mouth. And addressing the barriers. All patients have different needs, and instead of handing a patient a form to fill out, maybe we can sit down and go through the form with them. If it's a non-English speaking patient, using language-specific materials or giving language-specific forms can be helpful, and using an interpreter, whether it's the language line or an in-person interpreter, to help really make sure that these patients are getting information in a language that they will understand. And taking extra time for those who need it. When giving patient education materials, materials should be concise and clear to avoid information overload. Bulleted lists are preferable over blocks of text. It's less intimidating for patients and way easier to read. Reading material should be at a 5th or 6th grade level. And we want to make certain that the content is appropriate for the age and culture of the audience. In summary, ways to enhance literacy includes identifying these patients, identifying the needs of the individual patients, improving our communication, and addressing the barriers. If we spend extra time where it's needed, we can really make a difference to our patients and to their understanding so that they can take care of themselves. Now, that concludes my presentation on health literacy. What questions do you have?